The most common sign of dental anxiety is avoidance, meaning they avoid going to see the dentist. And so I'll have patients come in like, look, I haven't been in 10 years because they're afraid to do so. So I think that's the number one thing that I'll see. The second thing that I think is pretty common is when patients have a high level of fear or anxiety going into a procedure, they almost can't even wrap their heads around what we're going to be doing. And so a lot of times we'll have multiple consults. We'll spend a lot of time diagramming and going through everything A to Z. So they're really comfortable with at least the process of what we're going to be doing and what the end result's like. And knowledge is power, right? So a lot of times that knowledge helps reduce that level of anxiety. A lot of dental anxiety comes from bad dental experiences from the past. What I've seen with patients and what I've found is as they have positive experiences with me through the IV sedation, etc., that anxiety drops dramatically and they feel so much more comfortable. And then it becomes oh, this isn't a big deal. And that is really cool to see that evolution with people. When I have a consultation, right, when we have that first in-person visit and a patient comes in with a lot of anxiety already about dentistry, the first thing I should try to do is talk about zero dentistry. So there's no dentistry conversations. It's just I want to get to know the person. I want to get to know them as an individual, help them know what we're all about, and make that first experience very non-invasive. Once we've established some trust and they understand what our purpose is and how we try to help and how we're different, I think that's where the magic happens and we can start actually having really productive time and meeting together. Knowing that sedation is an option, which again, a lot of people don't know that this is an option because there's very few dentists that are trained and licensed to do this. So knowing that this is an option for people help eliminate that issue of avoidance. So now that they know, hey, if anything needs to be done, if I need this work, there's a way of me getting it done that's very comfortable for me in a way that's not going to freak me out. That's where I see the page turn in their lives, where they're like, okay, I'm coming in every 6 months. I'm getting my teeth cleaned. I'm having checkups done. I know I'm being more proactive because if something comes up, there's a way to manage it that I'm really comfortable with. There was a youngish girl in her early 20s. She was kind of the poster child of avoidance. Did not want to go to the dentist, even didn't really even take great care of her teeth. Just everything tooth related freaked her out. We sat down. I say to him, like, I just got to know her, let her get to know me, took some photos, just kind of talked about photos, talked about what her goals are. Little by little, built that trust. She needed a substantial amount of dental work done, actually. And so we used the sedation. We got the work done. But by the time we got to the point where everything was done and she was stable and she was kind of in this maintenance pattern, I remember a few years later, she had another issue pop up for her. And I said, okay, we'll set up the sedation. And she said, actually, you know what, Dr. Field, I know this is a pretty simple fix. And I trust you. I don't need the sedation. I'm good. And so to see her like graduate out of the need for sedation, like get to the point where she could tolerate something where even the thought of it previously caused tears, that was pretty powerful for me to see that change.